Well, good morning, everyone. We have a special guest in the studio this morning with us, and it's Dr. Scott Maanum from CHI St. Joseph's Health Primary Care Clinic. And they're located in the lower level of the hospital under the emergency department. If you haven't found out about it, make sure you take some time and check it out. That's CHI St. Joseph's Health Primary Care Clinic. New to our community, and of course, but not new to health care across the board. And not new to Park Rapids is Dr. Scott Maanum, huh?
Yeah.
You've been here for quite a few years and got roots in the community, so kind of nice to be with CHI St. Joseph's, isn't it?
It sure is. And thanks for that warm introduction. It's a pleasure to be here this morning.
Been with CHI St. Joseph's Health for about how long now?
I've been with CHI St. Joseph's since I started in the emergency department approximately 4 years ago, and I've been in the primary care clinic for a little over a year.
Yeah, and that's pretty new to our community, but it's growing, and additional services are being provided through the care clinic.
Mm-hmm. That's correct. So the clinic started with one provider, Dr. Dante Beretta, and I joined him about 6 months later. We've been there for about 2 years now, and we've since added a third provider, Beth Hurt, who's also local to our community, well-known. A graduate of our high school, same year as me, back in 1998.
So it was 98. You were 98, class of 83.
Yep.
Yeah. Your dad was a fantastic teacher.
Oh, I hear that a lot.
Yeah. Growing up, he was fantastic. So kind of nice to have roots come back home as a doctor and help care for the community that you grew up in and graduated with, and a lot of fun to do that. And tell me a little bit about of course, some of your specialties, a little bit about what you would do at the CHI St. Joseph's Primary Care Unit.
Sure. So I'm trained in family medicine. I graduated from the University of North Dakota in Grand Forks, and I completed my residency down in Iowa at Broadlands Medical Center in Des Moines. So being trained to be a family doctor, particularly for rural communities, we have a broad scope of practice, and that really allows us to care for people throughout their lifespan. And you can, imagine what that might entail. But we really pride ourselves on being able to offer primary, preventive care, also chronic disease management. Once established with us, we can certainly be a point of reference for referrals to specialists, or if any specific tests are needed. A lot of times people are more comfortable going to someone they know when it comes to an acute illness or a minor injury. So there's really a whole lot of things that a family physician can do, and most people know that because this community has been served by family physicians for a very long time, dating back to Dr. Grimes. And I believe he delivered me when I was actually born at St. Joseph's Hospital.
Same was I.
So.
Yeah, so I'm back in 65. So I didn't know you were a University of North Dakota graduate, so that's a good thing too. Same here. So we've got a lot in common. Both born here, raised here, and University of North Dakota, so that's fun. Let's talk a little bit about, so that's really exciting to have that extra coming back home, being a physician, helping the families, and having all. But what are you what are the most common reasons patients are coming to CHI St. Joseph's Primary Care Clinic and to you also?
Yeah, I think a big one for us, since we're relatively new, is the visit to established care, and again, that kind of speaks for itself. But it's really to try to establish a relationship and get to know one another. Just as important as it is for us to understand our patients and their health histories. The patients want to know who their doctors are, and they want to know if they can really, feel comfortable and feel heard and feel trusted. So that is one of the most important visits, is that initial point of contact, and to really build that relationship and to let that longitudinal care begin.
Well, the preventative care, having someone you can trust, sharing that with, taking the steps as you move along in your life, and also in your treatment care, and making sure that you're healthy. So very important, and it's
absolutely
got to be pretty nice to be able to have that. In addition, now you also have the hospital right there for you.
Right. We're very well supported by the hospital. We have a team of hospitalists who take care of our patients when they become hospitalized, and we maintain very good communication with them. Similarly, our emergency department does a phenomenal job, and there are a lot of challenges to providing care in a rural community, but with staff and their dedication and the resources that we have, everyone is on the same team and equally committed to the health of the community.
Yeah. And then when you take that primary care element at the clinic there too, you can kind of have trends of particular viruses, illnesses that are going through the community, and being close to that instead of they just show up for an emergency or a procedure or a hospital,
Right.
being able to watch that grow by seeing more and more patients helps, I'm guessing.
Yeah, we throughout each given week, we seem to have a little bit of a pulse on what's happening, what's common, what's a trend, and that again kind of comes with just being observant of what's going on around us, but maintaining good communication with the hospital and the ER, just trying to really understand how we can complement that comprehensive care that St. Joseph's can provide.
See more patients in the clinic environment help, because now you can see that trend in that community pretty
easily. Exactly. And altogether, for our volumes and our size, we have a pretty, small, set of, I guess, data to choose from when it comes to analyzing what our trends are. But the nice thing about us is that, we're seeing growth week after week, month after month, and it's really exciting to really see where this is going.
Oh, nice. So let's talk a little bit about some prevention strategies and that are out there. Let's talk a little bit about that. I think we touched just a moment ago is, that healthcare process. You're having your annual preventative cares and everything you're doing to keep you healthy, and the things that are changing, medicines and all. I mean, it's got to be an incredibly difficult to stay on top of it all. I mean, because it's ever changing. But so let's talk a little bit about some prevention strategies.
Sure. There are a lot of guidelines-based recommendations based upon age and gender, and a lot of those, really are probably not discussed as much as they should be, because a lot of the times people utilize care are when they feel sick. And so sick care ends up being, an emphasis of, trying to make diagnosis and a treatment plan to get people well again. And I feel like prevention, it's a good thing to really have an opportunity to spend time on that too. Usually it's when people are feeling well. But we realize the importance as family physicians. So those evidence-based guidelines really help us determine the recommendations regarding cancer screenings, for example. So, some people are eligible for lung cancer screening, and that's typically those that have a certain number of years of smoking. For other kinds of cancer screenings, breast cancer screening, of course, is well known, and CHI St. Joseph's does an excellent job of breast screening through our radiology department and mammography. With colon cancer screening, it's probably getting better known now, but not too long ago, the guidelines changed for that, now recommending screening beginning at age 45 for both men and women. So we want to try to use our platform to try to be, educators and counselors and advisors of health, particularly preventive care.
And that's one thing I think is, I was just there, had a colonoscopy. Meeting that milestone, turning 60, did it at 50, now it's 45, so hitting those milestones and following that so you can catch it early based on the guidelines that you were just talking about. But you add into it, in addition to that, family histories and things like that. I mean, you can get a pretty good trend of that individual and then start to set that up so they get some of those preventive cares or preventative tests done.
One of the great things about family medicine and primary care is I think we really want our patients to feel like we're treating them as an individual, a unique person, and not just a number. So when it comes to risk, that really is a person's individual risk, and it may be based on family history and other things. A lot of times health behaviors factor into that. So health risk assessments are a very important part of what we do. And at least annually, we try to focus on that. But our technology allows us to have some insight into those care gaps that we talk about. And that can provide reminders to the provider as well as the patient through My Chart, for example, which is a part of the electronic health record. And that can be a point of conversation then for any visit. So a person doesn't have to just wait for their annual appointment to talk about preventive care and other gaps that they may be wanting to close. goes.
I think it's it's ever changing. Having that electronics, the part of it, your medications, what you have, the procedures you have, setting up things. Hey, probably let's take a look at this in 3-4 months, 3 years, 5 years, whatever it might be. But it's also just that blood screening and annual screening and physical and going through all of that and watching your markers and where they're at and making changes there are so important. Last time we visited with CHI, we were talking about weight loss and some of the options there, but being able to have resources now through CHI, St. Joseph's Primary Care Clinic, tying it all together is really kind of cool. I mean, and being able to do that and being able to make sure that people are healthier moving forward. I think that's the goal.
Exactly, and I think that's well said. So, family physicians are going to try to treat the whole person, and they're going to try to bring it all together. They're going to try to be comprehensive, holistic, and really try to make care seem a little less complex. And I think that's one of the things our patients appreciate about their the time that they give us when we have them in the office. Yeah,
it's taking the time too to learn the patient instead of say, hey, take this and we'll see you in a couple weeks. No, it's understanding the patient and what the needs are. So
exactly.
I think the family histories are. I mean, that is really a lot of what you see. If they have a history of cancers or if it's heart, whatever it might be, is really a neat genetically to know that some of those trends are there. So
absolutely.
Beyond immediate prevention, we've talked about some of the general tips about maintaining good overall health, and I'm guessing that's exercise, doing this, don't eat this. I mean, all of those are right there now. I mean, if it's a referral or somebody else within the clinic, at least you can get them to the right space.
Right. Exactly. We have specialists within our hospital that we can refer to. We're starting from scratch. So beyond primary care, we have general surgery, and Dr. Gilmore has a emphasis in weight loss, and she certainly is broadly trained in general surgery practices. We have orthopedics, and the orthopedic team does a phenomenal job. So our referrals within our system can really help people with their general surgical needs and weight loss or their orthopedic needs. And if referrals are needed to a specialist that aren't under our roof at CHI St. Joseph's, we really have a lot of flexibility in helping people get connected to specialists wherever they want to go.
Yeah, well, that's great. So let's talk a little bit about when to seek some medical care.
Sure.
Another one of our topics. Let's talk. How's that? When to do it? What to do? Yeah, I mean, like you say, normally we were, just a little bit ago, you said people start to think about it when they don't feel well.
Right.
Let's talk about that. Age. I'm guessing certain milestones in your life at an age too. You got to start shifting and looking at different things too. But when should you seek that care?
Yeah. I think a lot of times people will wait for, some trigger or a light switch to go on to, indicate, do I need some help? Is this an issue with my health that I just can't manage on my own? We want people to be insightful like that. We want people to be attentive and alert. So I think that's the biggest thing, is just trying to, give yourself a moment to sort of check in to say, how am I doing? And, that's not just with physical health, that includes mental health. So in primary care, it's a good starting place. We welcome all questions. So a lot of times what we want people to know is that we're accessible and we want to field their questions, and we have staff that can help them. Now, sometimes it's hard to say over the phone, or it's hard to say over a portal message. So, being seen face to face is oftentimes, probably the best anyway, but often necessary to really determine if there is something more serious. So that question of when to seek care, it comes down to, judgment, but it's dependent upon, being attentive, and maybe, giving it, a chance to see, well, is this something that's going to be, getting worse? Is this something that's resolving spontaneously? so many scenarios there, and it's really hard to give just
very
one
complicated
blanket recommendation.
But you got to listen to your body.
Exactly.
That's probably as you start to age, or you really have, your body's going to tell you, and that's to me is a red flag. Well, I wasn't having these problems, and then get your annual blood draws and start looking at some of those and watch those markers. But you got to listen to your body.
Yeah, you do, and it does help to have, somebody who is experienced and trained in, health and wellness, disease, and natural courses of disease throughout our lifespan to really help answer those questions. Nowadays there's a lot of sources of information, and people are well educated. It's a fun time to be a doctor because I'm challenged continually by my patients who, bring a lot to the table with their own understanding and their own knowledge. And so it's really fun that people are being proactive and trying to seek the answers. And we encourage that. It helps make sure that we're all being kind of proactive in terms of maintaining wellness.
Yeah, Google it, right?
Yeah.
I mean, just this, and then it goes through, but every time you do that, it can scare you too. So that's
Absolutely.
why, because it seems like so many symptoms that you read about when you do that are common to all.
Right.
So then that's where you come in to help sort that out. And I think that's the most important part is saying, hey, you know what? It could be a lifestyle change. It could be a work change that started to make some changes in how you're feeling. But your body, your shortness of breath, some of the things that you're starting to experience, and the pressures of today too are immense on people with financially, the work and kids and whatever it might be. So you really got to pay attention. And if it's not right and you don't feel right, it never hurts to go find out.
Yep.
Matter of fact, it'll probably save you. And I know I had somebody that recently went in just for this just doesn't seem right, and found out he had a major heart issue that was starting to crop up. And by just listening and to himself, the body, he saved himself probably from a major heart attack.
That's a great example and very well said.
Yeah.
So I would say even at a minimum, if a person's doing well, they feel like they're, doing all the right things, it probably still is a good idea to touch base with their physician once a year for a checkup. And, they may learn something in the process. We certainly hope to provide value for the patient's time. And a lot of insurance plans value preventive care as well, and so that should be covered under their insurance. So it's just a nice way to kind of get back in the office to talk about what to look for in the coming year.
Yeah, it's how can patients be prepared for an appointment when coming to primary care? Obviously, an insurance card, right? Yeah. And what do you need? Well,
there's a lot of things. A lot of times, though, I feel like people simply can, just make an appointment. Don't hesitate. Don't overthink it. In order to, get an understanding of a person's health history, there's nothing better than just talking to the person sitting across from you. But medical terminology can be hard to remember, and the word can be, daunting. So, when physicians are reviewing health history, we certainly spend a lot of time looking through old records, reading reports from other doctors that have cared for the individual before we've had a chance to. And release of information is extremely important. So the permission a person gives to our clinic to be able to receive their health records from another facility, that is a prerequisite for us to really make sure that we are picking up where someone else left off and just continuing excellent longitudinal care going forward. So the release of information. And the next thing would be, an open mind. We certainly want to also, listen to our patients and understand their, what drives them, what their motivation is, what their goals and preferences are for their care. And we want to be able to tailor our care in alignment with those things. So those are a few things. And a final thing I would say is on the first visit at a new clinic, it's never a bad idea to bring your medications with you.
Right.
Because understanding that medication list, the doses, the frequency, is extremely important. And it's very common for people to know what the pill looks like, the color, the shape, but not the name. So when we're talking about medications in the office, especially at the very beginning when we're just trying to establish a good foundation, having those medications in hand on that first visit might be a really good idea.
Yeah, and I think it never hurts to do a medication review from time to time, and so many things change when it comes to medications, and not only does how they interact with each other and making sure it's right. Usually the pharmacist does a pretty good job catching some of that. I think there's a few checks and balances along the way, but as the trends change and things change, being able to make that, what might have occurred 10 years ago for your lineup of medications may be way different when you do a complete review of them again.
Absolutely. I think there's a tendency in medicine, and we're guilty of this as physicians, is that we want to do something, we want to treat something, and so naturally I think there becomes a tendency to prescribe, but it's oftentimes equally important to think about opportunities to de-prescribe and to take medications away that are no longer needed or that might cause side effects and interactions that, until we've really had a chance to talk it through, might be overlooked for quite some time.
Yeah, and then the interaction between the meds,
Absolutely.
and and finding out more as the, if it's a newer medication that's on 2-3 years later after it's been out there, there might be some tendencies or changes that have to occur. So that's a huge one. I mean, making sure not over prescribing, and then making sure they're not interacting with each other in the wrong way. Yeah, it's very big. Talking about having a primary care, I mean, being able to sit down one-on-one like we're doing right here is. Yeah. I mean, if you get that medical, let's say you're doing a procedure, or you got this name and that name. I mean, they're just way over the top. What's that mean, doc? What's that word mean? Or, the definition. I mean, it's very complicated because, there's some pretty big medical definitions that are out there, names, and can go over the client, or not the client, go over the patient's head very quickly. Yeah.
And it's nice to have the time in the office to really sit down then and try to break that down in a manner that's understood by all. And a lot of times, a patient may bring a family member in to help understand the condition, the treatment plan. And I think that's great. We encourage that. And if that would, help with retention of the information we're providing, or help with the reinforcement, and sometimes just an accountability partner of having somebody there to, hold you accountable, with those goals that we're setting and those commitments that we make. Again, focused on, better health.
Yeah, and a lot of times I would encourage that you always bring another set of ears, because especially if it's an adverse situation, sometimes the brain shuts off because you're so focused on what's the issue that's going on, and then you don't really get to the next steps and how it's, so having a second set of ears there is very, very important, or being able to digest it and then take a deep breath. And I'm sure you see it often. It's okay, so what more can I explain? Taking that next step. Because a lot of times when they first come out, it's the shock of, you got this, what are we going to do? They shut off because they're worried about what you just diagnosed.
Absolutely. We have a lot of training for having those difficult conversations, but until you're faced with those difficult conversations, they're still hard to initiate. There's always some, question about, word selection, and so I would say, as difficult as that information may be to hear, I think patients should also know that it's not always easy for physicians to be the bearer of that difficult information. So we try really hard to have empathy, to talk, not quickly or to feel rushed. We want people to have the time to process. We want to assess, a level of understanding before we, give that information. And I usually ask permission as well. How would you like this information to be delivered, or how would you like to receive it? Having another person present for difficult information or news can be very supportive, and it can it's just probably a better way to do it.
Yeah, yeah, and then that bedside manner that you have, and delivery and all that is so important. When it, I mean, we're very blessed to have you here. So it's, and also, it's St. Joseph's Health Primary Care Clinic keeps expanding, growing, bringing in new physicians, doctors, and just to make sure that our community can be healthy. And I think that's a very, very big plus for our community, having those options and being able to be part of CHI's clinic care.
I agree. Being aligned with our hospital, CHI St. Joseph's, I think it helps, the community feel a personal connection with our clinic, and us with them. We're deeply invested in the health of the community. And so, we want to send a message to the listeners and our patients that, we're there for more than just, sick care. We really want to help you through, all the other things too, whether that's prevention, chronic disease care, injuries, need for referrals, medication management. We've talked about a lot of those things already here in our time.
So, and it's just, I can't say it enough. I say it over and over and over. Annual. Do your annual. Guys, listen up out there. I know you can be stubborn. Guys, you're stubborn. Just go in and do it annually. Get it done. Visit with see where your markers are. Do the test. Take the time. It's worth everything, because so many things you can kind of see something's changing. Let's take a look. Catching it early is important in all aspects of it.
Absolutely. And we're trying to look for subtle clues. A person might be feeling well, might feel like it's perhaps even unnecessary to come in for an annual checkup. But sometimes we, uncover things that would have otherwise gone unnoticed that can make a big impact. And I think when people realize that, I think they feel fortunate and they feel thankful that they had that opportunity to give someone a chance to look for something that just might be beneath the surface.
Yeah, well, Dr. Scott Maanum, thank you so much for coming in this morning on behalf of CHI St. Joseph's Health Primary Care Clinic, and right here in our community. They're located on the lower level of the hospital under the emergency department area. Pretty easy to find. Just go in that same if it's, it was easy for me to find it the other day. So thank you for being here and just sharing with us, and I'm sure our paths will cross again. Yeah.
I certainly hope so.
Yeah, and then we'll probably visit again on the airways again as things continue to evolve and changes occur there. That we'd love to have you back and share some more things.
I look forward to that.